Good afternoon. Welcome to the CHES Leong Center Joint Round. I'm really delighted to use Susitha Wanigaratne. Susitha is a social epidemiologist in the Leong Center. She's an expert on immigration policy as well as migrant health, and turning her mind now to international students in Canada. I'd like to welcome her there.
Thank you, Ashley. Right, so I guess everyone can hear me online. I'll assume so unless I hear otherwise. Okay. So yeah, today I'm going to be talking to you about a scope and review that I've been thinking about and working on for probably 2 or 3 years. It's kind of been in the work. I have a wonderful team working with me, Astrid among them, but also my wonderful research coordinator, Ali, is up front, and Diana S. Practicum, who's working with us as well as many other people. So I'd like to thank you all for your support. Also, this is a community partnered project, and I think Prabjot is on the line from Latvia, celebrating and empowering daughters, that I'll talk about their work in a couple of slides. So these are the learning objectives that were on the advertisement for the talk. So I'll just read them out loud for you. So I wanted to start off with talking about why immigration and migration, as well as immigrant and migrant status, are structural and social determinants of health. I'm going to describe the current trends and characteristics of international students in Canada, and answer the question, how do international students in Canada access healthcare services, as well as what health outcomes and structural and social determinants of health are reported in Canadian grade literature on international students. So I've been struggling with how to, for a few years, incorporate immigration and migration policy into the understanding of social and structural determinants of health. So many of you probably have seen this figure in some shape or form. The original is in a little smaller form there on the top left-hand side of your screen. But I kind of moved things around a bit and put immigration and migration policy in between the structural determinants of health, as well as the intermediate determinants of health, excuse me. And the way that I'm trying to think about it and talk about it is that in a national context, government policies and influence migration and immigration policy. And really there's a reciprocal relationship between policy, immigration and migration policy, and macroeconomic policies, social policies, public policies, as well as cultural and societal values. If you're listening to lots of the news coming out of the United States, and not dissimilar in Canada, there's a pretty tight relationship between these policies as to immigration and migration policy. So in the Canadian context, immigrants come, these policies influence who comes to the country, and really once, according to different migration categories, the strata of these social determinants of health look different. So education, occupation, income, it all stratifies once immigrants come to Canada, and then, it influences their health. So hopefully that kind of gives you a little bit of a context of how I think about immigration and migration in the context of social and structural determinants of health. So one thing I'd like to talk about when I introduce a lot of my work is bringing out this one really great annual review in 2015 by Castaneda et al. And she's a researcher in Florida, but she did a really lovely, really comprehensive review of how research thinks about immigrant health. So, and kind of the reasons why immigrant health is worse or better, and kind of what are the determinants of that. So one of the things she said, and the author said in this particular review, is that really the health behavioral framework dominates how people understand immigrant health. So often it perpetuates narratives of personal responsibility, self-esteem, and self-efficacy. Often this is viewed as, these are viewed as deficit. The other common framework is the cultural framework. So this assumes great group traits, shared beliefs, values, etc., are explicitly linked to ethnicity, national origin, and they influence health behaviors and choices. And this framework often assumes, both positive and negative health behaviors and choices should eventually align with the mainstream population. So this is commonly referred to as acculturation in immigrant health research. But there has been, a fair bit of criticism for many years that this framework is ethnocentric. It assumes that people should be moving towards it. And another thing that I have gravitated towards in the recent years of my work is thinking more about immigration and health in the structural framework. So it's the least common discussed framework in the literature, and it really understands and accounts for large-scale social forces that impact immigrants. And she found that the literature largely focuses on access to healthcare and health outcomes associated with immigration and migration, living and working conditions. So it just kind of gives you maybe an understanding of how immigrants are talked about in the literature and how their health is framed. So, reflecting a little bit on that social determinants of health framework that the World Health Organization put together, can be a little bit hard to understand and kind of grapple with. So I often put up this tree as well to kind of make those determinants a little bit more concrete. So I really like this framework. It's from a group out of Massachusetts, and they refer to this as a health equitree. So they have health outcomes in the leaves of the tree, health behaviors of the branches of the tree, and the social determinants are this trunk. So these are the conditions in which people are born, grow, work, live, and age. So that's kind of the typical social determinants of health definition you hear. But I think there's kind of less talk about the wider set of social forces that shape daily conditions. So the root causes and underlying systems that we talk about. And I think in the context of international students, all of these are definitely part of the narrative we've heard in the last few years, and particularly the structural institutional barriers and determinants, which I think come out in the course of my presentation. So as I said at the beginning of my presentation, this work has been kind of in the works for a number of years. I've had a good fortune to be partnered with a nonprofit based out of Brampton that's now actually working nationally called Dalla, Celebrating and Empowering Daughters. And Manveer, who is the founder of Dalla, we've been working on other research for many years. And we were sitting at a coffee shop, I think in Hamilton, reflecting on a presentation we had given unrelated to this. And she was telling me about her work on international students, and I'd seen some of the work that they've been doing, through their advertisements on Instagram. And she just told me these incredible stories of these women that were coming from India and just like in dire straits, like really, really striking stories. And I know she was telling me about this report that they got funding to do called Women International Students, the Invisible Workforce. They had been working on this through the pandemic, and this report was published in 2023. But what they did was, in this report, they did community consultation, and they talked with 33 international students that were between the ages of 18 and 30. The purpose of it was really focusing on employment experiences, but their key findings were essentially that these women had experiences of being exploited by employers. They felt they lacked support just across all, facets of their lives. They felt isolated. They experienced harassment and discrimination and lots of experiences of fraud. So we kind of zoom out. These are the social and structural determinants of health that I referred to in my previous slide. So this is kind of the setup for how I kind of got involved with thinking about international students. And I have to say, before I had these conversations, I had no understanding of how many there actually were that were coming to Canada, and for many, many years. So I'll show you some of those stats in a bit. But from a global perspective, the definition of international students is a student who crosses international borders between two countries with the objective of participating in educational activities. And actually, the numbers of international students have been growing in many OECD countries for the last 15 years, and particularly around post-secondary enrollment. In 2020, there was about 5.9 million international students globally. And in 2020, at least there's the latest stats I could find, Canada was in the top 5. Just moving a bit to Canadian immigration, I've worked in immigrant health for 10 or so years, the focus of my work with Astrid has been around resettled refugees. And this is kind of the domain in which we've worked for many years, thinking only about permanent residents. And so this just is to give you an idea that, there are multiple categories of permanent residents. There's economic sponsored family as well as refugees. These are kind of the numbers over time. And you can see from 2015 to 2024, the numbers have increased with the blip in 2020 given the pandemic. But it was, a response by the government to increase immigration numbers to really respond to the economic conditions that were occurring in Canada. They wanted to make sure that we were still economically prosperous. So they increased numbers to address that. So this is, I think, typically the area in which people think about immigrant health is this permanent resident group of immigrants in Canada. But what was striking to me when I started looking at temporary residents is that the numbers of temporary residents are actually incredibly high. So this shows you trends over time between 1998 and 1994. And there were two different data sources on the IRCC website. So that's why the lines don't connect. But all this to say that you can see the orange line there. International students over time has increased a lot, especially in the last few years. And then if you add up all of these temporary residents in any given year, there's actually far more temporary residents in Canada than there are permanent residents. And we just don't hear much about them. So this is, just to highlight the numbers of international students that have been coming to Canada, in 2023 is upwards, at least this is permits, I think, upwards of around 700,000 permits. What that equates in a given year is kind of uncertain from the data, but that just kind of gives you an idea of what's happening over time. And there has been a number of sources that I have that say, the reason why international student permits have increased over the years is ultimately because provincial governments have been cutting post-secondary institution funding, and this is a good way for them to still make sure that universities and colleges have the funding they need to operate. So international students in a Canadian context, I found a stat that said in 2023, there are about 1 million students with active study permits in Canada. So something you never hear about, a huge amount of students. And then this is just a map kind of describing where international students are coming from in 2024. And there I just ranked the top 5, but you can see that India and China have by far the largest numbers of students coming to Canada. And that's kind of been the stable numbers over the last 10 years. They kind of alternate between 1 and 2 in any given year. But then there's really students from everywhere, as you can see from the map. As well, in terms of where international students go to when they come to Canada. So about 50% end up in Ontario, 20% in BC, 14% in Quebec, and distributed throughout the country. In terms of what level of education they're enrolled in, most are coming for post-secondary studies, but then about 20% in any given year attending high school and below. So in terms of what international students are contributing to Canada, there's a stat, I think this is from 2022, that said, that everything that they're contributing to the country, tuition, housing, food, all the things, amounts to about $37.3 billion. And so that's, there's other GDP comparisons, and the one that the particular article that I was reading compared it to wood and wood products. So obviously completely different domain of how the country receives GDP funding, or GDP dollars, but it was $26 billion. So that's just a point of comparison. And then the average Canadian tuition domestically is about $8,500, and this compares to a whopping almost $50,000 for international students, just to give you an idea of the amount of money students pay when they come to Canada. So international students have been making the news a lot in the last 6 or so months, particularly. These are just kind of a quick snapshot of things that I pulled up when I did quick research. So, recently there's been a limit on international student permits that came out in September last year. There's been studies on how, students are not to blame for the housing crisis. There's Ontario limiting medical student enrollments that are international students, use of food banks, people experiencing racism on the street in Saskatoon. So a number of different, just a huge array of how international students are making the news. I also wanted to play about a 2-minute clip from this TVO mini documentary. So this was aired in July of 2024. There's also a really great Fifth Estate on CBC documentary as well. That's about 60 minutes long. And I'll just play 2 minutes from this. And my intention for this is we hear a lot about international students, but we don't necessarily hear their stories. So this is one student.
So you think you know Wix, but do you really? First up, we've got Shape Video Map. You can use different shapes to create completely different vibes and aesthetics. Or you can create your own graphic. I use the shape composition here. Just import any SVG file and set it.
There's a skip down at the bottom by the SickKids logo.
Yeah, I'm trying.
As a shape mask. Nice. Next up, we'll keep it moving with the hover box. You can use it to
Not what I intended.
animate any element and create these really eye-catching.
Sorry, I'm gonna stop sharing.
Following program contains subject matter that some viewers may find disturbing and may not be suitable for younger audiences.
Can I go back and share my screen? I don't think the audio.
Viewer discretion is advised.
Students, they are vulnerable.
We've got students living in cars. We've got students living.
Sorry, it's not.
When it came time to take things to the next level, I knew that I had to make a website, and Wix was perfect for that.
Following program.
There we go. Sorry about that.
Over the last decade, millions of international students have been enticed by the Canadian dream. More than 50% came to Ontario. The fees they've paid have kept our universities and colleges running. The experience for many international students, however, is not so much a dream, but a nightmare. Natalie Carr is a first-year student from India with ambitions of becoming a dentist. Why do you want to be a dentist?
Because my uncle from my village is a dentist, and all my relatives always pay my uncle, and he is a very big dentist. So from my uncle, I got some motivation. So
I want to be like him.
yeah, my father is a farmer, and my husband is a farmer, and in my family there is no one who belongs to professional job. So I want to.
You want to be the first.
I paid first semester 9,000, and my family gave me that money. And after that, I find a job as a part-time student job. Even they don't give me pay. I went there because in the hope I get the that job, and even I able to afford some food every day, and but they deny to give me pay, so I waste 2 months there.
When you worked for the 2 months and they didn't pay you, how much money do you think you lost out?
I think 600. I just want to find a way how I can manage whole things, because it is my not only my dream, it is my family dream also. Their whole life saving, they just feel happy. They give it to me, and I'm asking. I have no money for food. They send me money.
So it's not just about you, this is about your
Yeah.
whole family.
Even my family is a farmer family. They support me continuously. Even 6 months I have no work, they send me money.
I wanted to share that because, this is one story, obviously a very striking story, but I think it's, from my experience, just watching what's going on in terms of like what's being talked about international students. Oh, sorry. I just felt that was important. My technological skills are not today. Okay. Sorry. Yeah, I just wanted to share that it's one story. The Fifth Estate documentary also has a number of stories that are similar. So I just wanted to share that as some context. Some other, I encourage you, if you're interested, to watch the whole documentary. There's some interesting conversation about health as well later on.
Story of a few women.
Okay. So the way we decided to approach, thinking about how to just look at the evidence was a scoping review. So for those of you who may not be so familiar with the differences between systematic and scoping reviews, just kind of put up some quick characteristics of them. So, the orange on the slide here is the scoping review approach. So really, it's meant to address really exploratory and broad questions, whereas a systematic review is often very specific, often quantitative. And really what you're trying to do in a scoping review is to provide an overview of available research and really not producing a summary answer.
Sorry, are you sharing with the online people? I think it's not sharing.
Oh, sorry. Thank you. Better? Okay, so yeah, we approach this with a scoping review, and one of the main differences is really that it's a broad question, and you're not focusing on meta-analysis. You're really just kind of descriptively approaching, looking at the literature, and there's also reporting guidelines to support this. So we took a scoping review approach to this. One of the things that's, I think, kind of newer in thinking about writing a scoping review or doing a scoping review is publishing a protocol. Typically, they're not peer reviewed and published in a journal, but the librarian we work with here at SickKids suggested we post it up on Open Science Forum. I can't remember what the F stands for, but it's OSF. So that's what we did. We worked on a protocol for a few months, and it was published or released on this platform in October. So in terms of the research questions, what we were trying to do is to describe healthcare access and health outcomes among international students across all ages and education levels. We are looking at the 10 countries that had the most international students, I think, in 2022. And we're looking at the literature published between 2013 and 2014. And we have this broad scope to start with, but given what's going on in Canada with international students, we're also doing a paper on Canadian international students as well. But the same research questions apply. So the first one was we really wanted to get a handle on how international students are accessing healthcare services, their coverage details, as well as the eligibility requirements. In terms of the last questions 2 and 5, we're doing both a gray lit and a peer reviewed search on these questions. So we're looking at describing the characteristics of the studies and the study populations that examine healthcare access and outcomes. We're also looking to describe the health outcomes themselves, as well as in this bucket of studies or gray lit hits that look at the health outcomes of international students. How many are actually talking about the social and structural determinants of health, as well as we're looking at to see essentially whether intersectionality is also discussed. So looking at intersecting social and structural determinants of health as well. And then we're trying to get a handle on whether there is a relationship between the social and structural determinants of health, as well as who health outcomes and healthcare access. So in terms of the inclusion criteria, again, this is the definition that I described previously. We're looking at health access and health outcomes. We had a really broad, interest to start, but given how challenging it is to, focus, the librarian suggested we kind of do a quick review of the literature and see what are the big health outcomes that kind of emerged. So these are the ones that we decided to focus on. We're still mental health, sexual and reproductive health, occupational health, oral health, as well as tuberculosis and inflammation. I'm not quite sure why those came out, but those were the ones that came out, so we included them in our search. And then when we moved to do the gray lit, we also added mortality and violence, just given what we had seen in the popular in the media and things like that through the summer. So we included that as well. And again, these are the 10 countries that we So in terms of the first question, we are looking at gray literature from government and health agency websites. So this is trying to get a handle on how international students are accessing healthcare. And for the remainder of the presentation, I'm mostly going to be focusing mostly on Canada. So the approach we took for Canada was to look at provincial and federal health agency websites, as well as institutional and benefit provider websites. We did Google searching and then kind of just, went down rabbit holes to find, the relevant information. We're extracting details on healthcare insurance, details of coverage, as well as when it comes to private health insurance, we're kind of looking at the same thing. So this is quite a busy table, but this is the results describing how international students access healthcare in Canada. So this is divided by, access to public health insurance, public healthcare insurance as well as private, and the green rows are provinces in which students are eligible for provincial healthcare insurance. So for the vast majority of provinces and territories in Canada, that's how they will access healthcare. But for provinces, Manitoba, Ontario, and the Yukon, they're not in Ontario, not eligible for public health insurance, which was a surprising finding to me. I didn't realize that. And then some interesting findings, it kind of depends on whether the student is full-time enrolled, whether the length of their study permit. So there's a lot of variability. Another interesting thing was that in BC, although they have access to provincial healthcare insurance, they actually have to pay $75 a month to access it. Whereas in the other provinces that have access, there's no fee associated with it. And then when it comes to the provinces that don't offer provincial healthcare insurance to international students, they typically will get access through their institution. There's UHIP in Ontario, there's an analogous one in Manitoba. But there's some smaller institutions, private institutions that might not have those plans available, and ultimately they pay for those through accessing their own private insurance as well. And another interesting thing, Quebec does offer provincial healthcare insurance, but only for some countries. So not students from all countries have access to it, like kind of a select number of European countries there. So in terms of the second and the last 4 research questions we had looking at healthcare access, health outcomes, as well as the social and structural determinants of health. What we've done so far is mostly the gray lit search. So that's kind of what I'm going to be talking about the most. So the purpose of this part and looking into the grade literature is really try to understand, the mainstream conversation and interest, like what's going on, what's the kind of main discourse happening in Canada and these countries relevant to international student health. So we decided to use Google Advanced Search to do this. We were looking for grassroots organizations, news articles, kind of anything. Talked about international students. We essentially just excluded ads. We had 6 pre-specified categories that I have listed there on the screen. There was 2 reviewers doing this. We kind of both conducted the search, focused in a particular country. We compiled the hits that we got separately, and then between the 2 reviewers, there's one of us that's extracting everything, another person extracting 25%, and to ensure quality and consistency of the extractions. And the extractions, again, are just based, the data we're extracting is looking at health outcomes and mentions of the social and structural determinants of health. So we did this, we managed to do this for all the 10 countries to start with. So this is just a quick distribution of what that looks like across the 10 countries. Australia had the most hits at 49, followed by Canada, the US, and the UK. This largely reflects the distribution of international students globally, which I found reassuring. But just to focus on what we did for Canada. Initially the 2 screeners, myself and Ali, one of us had 39, the other 24. There was 9 duplicates were removed. And then we did screening, and then ultimately we came up with 37. So this is what it looks like in terms of, where we pulled grade lists relevant for international student health. Most of the hits, so about 40% of the 37 that we found were from essentially non-mainstream media, so local publications and online magazines. We also found some peer-reviewed studies. Again, we decided not to exclude them because those were kind of the hits that came up. A fair number of educational institutions also had specific hits based on international students. In terms of the distribution across the country, largely reflecting what's going on in terms of numbers, I suppose, although really heavily in Ontario. So 23 of the 37 grey lit hits for Canada were from Ontario, and then a few, 4 in Quebec, 4 in BC. So in terms of, out of the 37, what health outcomes we managed to identify, the vast majority of them were in the mental health and disorders kind of bucket that we were looking for. So 50 out of 94. The second most frequent was violence, and then oral health. So actually, sorry, not oral health, mortality. Those were kind of the largest 3. And then also created this look at like kind of subcategories of mental health disorders and how we categorize them. So general mental health illness, but then stress, anxiety, isolation, depression, those are kind of the largest buckets of mental health kind of specific outcomes that we found in the Canadian Grey Lit. And just descriptively, just to kind of go into some of this a bit more, the most frequent violence-related outcomes were sexual violence and sexual assault and harassment. The mortality one, the literature talked about suicide and overdose that led to death. And I was just, I'd heard about this before, but then there were, a number of hits that described this. So I just wanted to describe a bit more about, where these were coming from. So there was a lot of community organizations that were interviewed in these sources. So mostly from Ontario and BC. There was a Ontario funeral home director that was interviewed I think he's actually interviewed in the TVO documentary that I showed you, but he was basically describing that, 4 to 5 students are being sent back in body bags to India monthly. So he didn't really give like a time span, but that was very striking. And I also found one of the hits that we got had stats actually from the Indian government that stated that 172 students died in Canada between 2019 and 2024. And this compared to 108 in the United States. So very striking. And I think, the student body suicide, I guess, is not not an uncommon thing to happen in a student population. But I think just given the context of this particular population and the stories that were in these particular sources are pretty striking. Some other things that we found that we didn't expect. So people were experiencing, fear of jeopardizing their citizenship and residency status in relation to, kind of the abuse they were experiencing in various environments that they were exposed to. And also in terms of dental care access, there were actually, this is not a frequent thing, but we didn't expect to see students actually traveling back to their home countries to receive dental care. Because it either wasn't accessible or was too expensive or something like that. So interesting findings there. In terms of the social and structural determinants of health, there was, a number of larger categories that we looked at. So language and culture were kind of the biggest ones, as well as health services. So like access and quality. People talked a lot about employment and income, as well as housing. And there were a number of other ones, including government policy. And just to kind of go into this in a little bit more detail as well, in terms of income and employment, people talked a fair bit about, the financial stability or lack of financial stability and security they were feeling, as well as lots of experiences with inadequate and unaffordable housing. A striking finding that I thought was interesting was people's experiences of exploitation across like multiple systems that they interacted with in Canada. So jobs, government, colleges, even their peers. So that came out kind of across a number of determinants of health that we looked at. So that was so that's kind of a quick summary of our gray lit in Canada. And I'll just talk briefly about our methods into doing the peer-reviewed literature. So same focus on healthcare outcomes and health access, as well as the social and structural terms of health. We did work with the librarian here at SickKids to pull together, all the relevant search terms. And she indicated, just given that we're into, our question was very broad, she suggested we look at 7 databases. We completed that search in October of last year. Again, we're going to be doing the same process: 2 reviewers, title and abstract screening, full text screening, and data extraction. And we're going to be just looking at the frequencies of health outcomes, social determinants of health, etc. Given we have a very large focus on those 10 countries, again, we're going to be focusing in on Canada to start. And we have both Ali and Diane working on doing the title and abstract screening is now done for Canada, but now we're going to be working on. So just to kind of give you an idea of what we're starting with for across all the 10 countries. We had 6,000 articles to start. A number of 1,500 got excluded, so now we're sitting at about 4,000. We did do like a pretty intense search to find the Canadian studies to pull them out to kind of focus on those first. We screened about 281 Canadian studies. Many of those got screened out, and now we're sitting with 52 Canadian studies going into the full text screening. So for the next couple of months, while we have Diane working with us, we're going to be working on completing screening and extraction, and we're going to write up the paper that's focused on the Canadian studies and return to the larger study with the 10 countries. So this is like the last slide before the any questions and comments that you have. So just to give you a summary of what we've found so far in terms of what's happening in Canada. So again, Manitoba, Ontario, and Yukon are the only provinces and territories where students are not eligible for provincial healthcare insurance. They largely will access it through their public institutions or private plans if they need to. Quebec and PEI have restrictions on access to provincial health insurance. In terms of the gray lit, the largest source of the Canadian gray lit sources was non-mainstream media. So again, local publications and online magazines. Over half of the mentions in the gray lit were for Ontario. The major categories of health outcomes were mental health, violence, and mortality. And the social and structural determinants of health mentioned were largely language and culture, health services, employment and income, as well as housing. And that's it. Open to suggestions, comments, questions. Apologies for the technology.
And how do you, what are you going to use? How are you going to use your results? Like, what's your aim once you have all the data in hand?
I think part of what we wanted to do is, I mean, just to get an understanding of what's going on. I think given just the sheer number of international students, which again was surprising, there's opportunities to like use that, use what we find and try to focus on doing some more quantitative work. ICS has, where I'm a fellow and again did a lot of my work, has temporary resident data. There's some issues with how it's how international students are represented because there's no linkage to health service data, but because they're not eligible for provincial health care. But anyway, my aim is to, potentially identify some questions that are emerging either from the Great Lit or even from peer reviewed lit and do some quantitative studies. It's possible with data out in BC because they have IRCC linked data there as well. So that's one of the things. I hope that it's useful to my partners so they can advocate for their own programs to support international students as well. It's kind of what I'm thinking of right now. But someone in the chat. Somebody online have a question? Sorry, I don't see the text.
Oh, hi. I did put a question in the chat. I don't know if you can read it. Just, I think that, thanks very much for the presentation. Given the reliance on private insurance for students in Ontario, I was wondering whether you're planning on sharing these results with secondary school institutions or, places like Ministry of Colleges and Universities to say, what are those minimum expectations of what private insurance needs to cover. I think we see a really wide variety of, some of them only require emergency care as a minimum coverage, while others require more comprehensive insurance plan. So whether this is something you're thinking about as a next step for sharing your results.
Yeah, I don't have any direct connections right now, but for sure we're going to disseminate the findings as widely as we can. I think your comments resonate with some of the Grey Lit findings as well in terms of like access to mental health care was one of those things that, for all Canadians, it's often out of pocket. So, but given the need in international students, that's definitely one of the things that isn't often covered by obviously provincial plans, but even private plans. And then often the quality of that service is often not great either. So that's definitely something that would be, I think to highlight in something like that. But if you have any connections to, if you have any suggestions of people to connect with, I'm happy to start collecting that information to disseminate our findings to those people. Thank you for your question.
Thank you. It's a fascinating area of study. I'm wondering, do you have a sense from your initial extraction if their health outcomes differ by program of study for the students, as that will help targeted potential approaches with various programs?
That's a good question. I don't think that was something that we had thought about extracting from the Grey Lit, but that's something we can add in the peer-reviewed literature going forward. I don't know if it really is reported that often. It seems like a convenient sample of international students from so whether they report on particular programs would be something to add to our extraction. Thank you for the suggestion.
There has been a big articulation by the universities, though, that they want to differentiate between how they treat their students and the colleges and the private colleges. So there definitely is, so maybe not like discipline, but certainly like where they're lying, what kind of educational institutions they're landing at, I think is really important.
Yeah.
I just had a sort of somewhat related question, but you're focusing largely on the 70% that are post-secondary. Is there any scope or thoughts to look at the 20% and just anecdotally?
Yeah, for sure. So nothing came out in the grade lit in terms of looking at that particular subpopulation. They are sizable. So
Yeah.
20% of any given year is students in high school or lower. That's definitely something we're going to be try to pull from the peer review lit. But so far it seems like largely representative of, largely to represent post-secondary students, but it's definitely on our radar given we're at SickKids. Yes.
This is so interesting. Thank you, Steve. Curious, what were the things when in your conversations with your community partners, what were the questions that they were particularly hoping to come up?
Yeah, I mean, they are very like community focused in a particular community. So they're a gender equity focused nonprofit in South Asian. So I mean, their focus is on female South Asian international students. And they really wanted us to try to take an intersectional approach to our analyses to make sure we were pulling out gender and race, which we are. But I think it's interesting. I'm super grateful to be working with them. It's such a reciprocal relationship because I can hear about what's happening on the ground. Often I don't think the things that we're going to discover are going to be surprising to them, but I'm hoping that, having a paper that kind of has collected this information will be useful in their conversations with other people. That's kind of what I hope will come out. And we are, Diane, Ali, and myself will be presenting to them the Canadian results later in March or April. And hopefully we'll have some more fulsome conversations about what they can do with it.
Have you considered having your partners inform some of the variables that you're going to be extracting on that peer reviewed?
Yeah, they were authors on the protocol, so they did read through it. Again, they wanted, for sure looking at gender and for sure looking at race. But other than that, I mean, we've made quite a bit of progress and not been able to connect back with them quite yet. But so we'll, I've given them an update, and I have we have a pretty, we're friends as well, so we communicate relatively frequently. So if anything comes up, I'm hoping it'll be filtered down to me. So, but yeah.
And asking students themselves.
Definitely.
Partner organization.
For sure. Yeah, we do have one former international student who's an author out in BC. So I'm hoping to kind of leverage her lived experience through the project as well. But I'm always looking for opportunities to have international students themselves involved in the project and hear what they say. So yeah. Thank you very much.
What's that?